Nearly 9 out of 10 American adults are metabolically unhealthy right now. Not overweight, metabolically unhealthy. That is a different thing, and it is a much bigger number than most people expect. I'm Dr. Gurpreet Singh Padda. I run an interventional pain practice in St. Louis, and I want to explain why a pain physician spends so much time talking about metabolism. Because almost every patient who walks into my clinic in pain is also carrying a metabolic problem nobody has named yet. Their inflammation is high, their insulin is high, their pain is worse because of it, and it responds less well to everything I can offer them procedurally. So we are going to start where the problem starts. Not with diabetes as a diagnosis, with the years and often decades before that diagnosis, when the damage is already accumulating and the standard lab panel says you are fine. Obesity, prediabetes, and type 2 diabetes are not three separate diseases. They are 3 points on one continuum, and that continuum runs underneath most of modern chronic illness, heart disease, several cancers, Alzheimer's disease, and a great deal of chronic pain. The common thread is metabolic inflammation. I describe the driver as malnutrition of overconsumption, eating a very large number of calories while remaining genuinely deficient in what the body actually needs. Here is the part that matters most. The best time to reverse diabetes is before you have it, not at diagnosis. Before. Because by the time a physician writes type 2 diabetes in your chart, your body has usually been managing the problem quietly for 10 to 15 years. 3 things in the modern diet drive this. I want to be specific because vague advice is useless. Sugar. It spikes blood glucose, which spikes insulin, which drives fat storage and, over time, insulin resistance. Industrial seed oils. High in omega-6 fats, chemically fragile and inflammatory in the quantities we now consume them. Refined grains. Stripped of fiber, they convert to glucose almost as fast as sugar does, and they feed the same cycle. Sugar plus vegetable oil plus refined grain. That is the equation. Those 3 ingredients are in nearly everything sold in the middle aisles of an American grocery store, and together they produce obesity, prediabetes, and type 2 diabetes. Now, the numbers, and I want to be careful here because these get quoted loosely. Using National Health and Nutrition Examination Survey data from 2009 to 2016, researchers found that fewer than 1 in 8 American adults, 12.2%, is metabolically healthy. That is the reliable population figure. It means roughly 88% of us fail on at least one of blood sugar, blood pressure, triglycerides, HDL, or waist circumference. There's an older and important observation behind this. Dr. Joseph Kraft ran over 14,000 glucose tolerance tests with insulin measurement between 1972 and 1998. He found that a large majority of his patients had abnormal insulin responses even when their glucose looked perfectly normal. His was a referred hospital population, not a random sample of Americans. So I won't extrapolate his percentage to the whole country, but he identified something decades early. You can be hyperinsulinemic long before you are hyperglycemic. This is why prediabetes is such a misleading word. It sounds like a warning. It is actually a description of disease already in progress. In the pre-diabetic state, we already see changes in immune cell function, inflammatory cells migrating into tissue that is already inflamed with upregulation of cytokines. That is not a future risk. That is happening now. And cardiovascular risk does not politely wait for the diagnostic threshold. There is a continuum of increased microvascular and macrovascular risk that extends well below the glucose cutoffs we use to diagnose diabetes. Now, let me be straight with you about the limits of the evidence because you deserve that. Trials that treat prediabetes have consistently shown you can prevent or delay diabetes itself. What they have not yet shown is a reduction in heart attacks or death. So when I argue for early intervention, I'm arguing from the risk continuum and from preventing the disease, not from proven mortality benefit. Anyone who tells you otherwise is overselling. One more thing before we go further, and it's uncomfortable. In 2015, Credit Suisse, an investment bank, not a medical journal, and I want you to know that, commissioned a global survey of physicians and nutritionists. 92% believed fat consumption causes cardiovascular disease. 87% believed it causes obesity. 83% of doctors believed butter was worse for you than margarine. 66% believed vegetable oils were good for your health. I trained in that same system. Most of what I was taught about dietary fat in medical school has not survived contact with the last 20 years of evidence. So if your physician has given you advice that hasn't worked, that is usually not incompetence. It's a curriculum problem. In the next video, I'll show you exactly how that curriculum went wrong and who paid for it. If you are carrying pain and carrying weight, those two things are talking to each other. We treat both at the Padda Institute because treating one without the other doesn't hold. Padda Institute Center for Interventional Pain Management, 4477 Woodson Road, Suite 100, St. Louis, Missouri, right next to Lambert International Airport. Call 314-481-5000. This video is educational and is not medical advice. Do not change or stop any medication without speaking to your own physician.